Hello friends, welcome to my channel. Today we will be learning about the fibula. The fibula is the lateral and smaller bone of the leg. It is very thin as compared to the tibia. It is homologous with the ulna of the upper limb. It forms a mortise of the ankle joint. Now how do we determine the side of a fibula? The upper end or the head is slightly expanded in all directions, as you can see here. The lower end or the lateral malleolus is expanded anteroposteriorly and flattened from side to side. The medial side of the lower end bears a triangular articular facet anteriorly and a deep or malleolar fossa facing posteriorly. This is the triangular articular facet and this is the malleolar fossa. Now if we try considering this fibula as of the left side and place our thumb in the malleolar fossa in this way, we will observe that the triangular articular facet is facing posteriorly while the malleolar fossa is facing anteriorly, which shouldn't be the case. So we try holding this fibula in our right hand considering it as a right fibula. Then we observe that the triangular articular facet is facing anteriorly while the malleolar fossa is facing posteriorly. So we come to the conclusion that this fibula is of the right side. The fibula has an upper end, a shaft and a lower end. Now let's look at the upper end of the fibula. The upper end is slightly expanded in all directions. The superior surface bears a circular articular facet which articulates with the lateral condyle of the tibia. The apex of the head or the styloid process, as you can see here, projects upwards from the posterolateral aspect. The constriction immediately below the head is called the neck of the fibula. Now let's look at the lower end of the fibula or the lateral malleolus. It has the following four surfaces. The anterior surface is rough and rounded, as you can see here. The lateral surface is subcutaneous. The posterior surface presents a groove, while the medial surface presents a triangular articular facet. The shaft of the fibula has three borders and three surfaces. The borders are the anterior, medial or the interosseous border and the posterior border. Now let's learn how to locate these borders. Looking at the lower end of the fibula, we have the deep malleolar fossa, above which we have a triangular area, and the anterior border to it, that is right here, is traced upwards as the anterior border of the fibula. This is the anterior border of the fibula. Now after locating the anterior border, when we hold the bone vertically, we can see a border just medial to it, which is called the interosseous border or the medial border. The surface that lies between the anterior and the interosseous border is very thin, as you can see right here. This is the anterior border and this border is the medial or the interosseous border. Just next to the medial border or the interosseous border, we have a depressed surface and next to it lies the medial crest. Moving more anti-clockwise, we have the posterior border that lies right here. Summarizing the borders once again, we have this as the anterior border, this as the medial border or the interosseous border, the medial crest and the posterior border. Now let's look at the surfaces. We have three surfaces. The medial surface lies between the anterior and the interosseous borders or the medial border. In its upper 2/3, it is very narrow, as you can see right here, measuring 1 millimeter or less. The lateral surface lies between the anterior and the posterior borders. It is twisted in its lower end, as you can see right here. This is the lateral surface. The posterior surface is the largest of the three surfaces. It lies between the medial border or the interosseous border and the posterior border. It is divided in its upper 2/3 by a medial crest right here. Now before I start with the attachments, please note that the red color, the yellow and the orange color represents the origin of various muscles. The blue color represents the insertion of muscles, while the green color represents the attachments of ligaments and joint capsules. Beginning with the attachments on the surfaces of the shaft, the medial surface of the shaft gives origin to the extensor digitorum longus in its upper 1/4 and the anterior half of the middle 2/4. The red color right here symbolizes the extensor digitorum longus. This muscle is the extensor digitorum longus. The origin of the extensor hallucis longus takes place in the posterior half of the middle 2/4 of the medial surface of the fibula, that is represented in yellow color right here. This is the extensor hallucis longus. The peroneus tertius originates from the lower 1/4 of the medial surface of the fibula. This muscle is the peroneus tertius, also called the fibularis tertius. Now moving on to the attachments on the medial surface of the shaft of the fibula, the peroneus longus originates from the upper 1/3 and the posterior half of the middle 1/3. This muscle is the fibularis longus. The peroneus longus is also called as the fibularis longus. The peroneus brevis originates from the anterior part of the middle 1/3 and the lower 1/3 of the lateral surface of the shaft of the fibula. This is the fibularis brevis. Now looking at the attachments on a part of the posterior surface that lies between the medial crest and the posterior border, the soleus muscle arises from the upper 1/4 of this surface, as you can see right here. The flexor hallucis longus muscle originates from the rest of the 3/4 of this surface, as you can see in yellow right here. This is the soleus muscle. This is the flexor hallucis longus. The part of the posterior surface that lies between the medial crest and the interosseous border or the medial border gives origin to the tibialis posterior that you can see in orange right here. This is the tibialis posterior. The head of the fibula receives the insertion of the biceps femoris on the anterolateral slope of the apex. This is the biceps femoris muscle. The triangular area above the medial surface of the lateral malleolus gives attachment to the interosseous tibiofibular ligament in the middle, the anterior tibiofibular ligament anteriorly and the posterior tibiofibular ligament posteriorly. The lateral malleolus gives attachment to the anterior talofibular ligament on the anterior surface. The slight notch on the lower border gives attachment to the calcaneofibular ligament. I hope you found this video helpful. To get updates on my latest videos, click on the subscribe button. To get notifications, tap on the bell icon. Thank you for watching.